Welcome to another important video where we will discuss high-yield multiple choice questions that have been asked in previous competitive exams and which are also crucial for your upcoming exams. So make sure to watch the video until the end. In this video, I will share essential tips and key points to help you solve these MCQs. So let's start the video. So begin with general microbiology. In general microbiology, these topics, culture media, blood spill, and sterilization and disinfection are the most important topics. So let's move on to our first question from sterilization and disinfection. So our first question is endoscope is sterilized by, and these are the options. Okay, so you should know that endoscope is an instrument used for internal examination of patients. And these instruments are made up of tubes and lenses, making them heat sensitive. Means if you use high temperature, the instrument may get damaged. Therefore, we cannot use high temperature sterilization methods for such instruments like endoscopes, bronchoscopes, cystoscopes. So, how do we sterilize these instruments? Well, these instruments require high level disinfectants. Why high level? Because these instruments come into direct contact with the mucous membrane of the human body. So we must use high level disinfectant to eliminate bacteria, viruses, fungi, and even spores. So to answer this question correctly, you must know the examples of high level disinfectants and which include glutaraldehyde. This is the most commonly used one for endoscopes. Second, OPA, hydrogen peroxide. So these are the examples of high level disinfectant. Let's analyze the options. Number one, autoclave. Absolutely no, because autoclaving is a moist heat based method which could damage the endoscope. Number two, hot air oven. Not at all. Hot air oven based on dry heat sterilization method. Number three, inspissation. Inspissation method is used for sterilization of egg and serum based media, and this is not for heat sensitive instruments. And fourth option, glutaraldehyde, and this is the correct answer. Okay, so our next question is a patient presents with fever and chronic cough. The doctor performs a chest x-ray which is suggestive of tuberculosis. Then a sputum smear test is performed and it is found to be negative for acid-fast bacilli, meaning no TB bacteria are seen. So the question is, what should be the next step to confirm tuberculosis? So this is the scenario. The X-ray suggestive of tuberculosis, but the smear preparation is negative. And these are the options. Okay, so to answer this question, we must follow the TB diagnostic algorithm. And according to TB diagnostic algorithm, the first step in TB diagnosis is the sputum smear microscopy and chest X-ray, which have been already performed in this case. And the next step here is CB-NAT. CB-NAT is the best next step, and it's performed in both the cases, whether the sputum smear is positive or negative. So let's quickly understand what CB-NAT is and why it is the best next step. CB-NAT stands for cartridge-based nucleic acid amplification test. In short, it is an automated PCR test that detects Mycobacterium tuberculosis DNA in the sample. And why is the CB-NAT the best next step? Because it is highly sensitive. It can detect TB even when the smear test is negative. And second, it provides rapid results within a few hours. And the third important, it can help in deciding the best treatment for the patient. It detects rifampicin resistance as well. So the CB-NAT is the best choice for confirming tuberculosis. Let's go through the options one by one. They have given repeat sputum smear, not useful since the first smear was already negative. Second, sputum culture. Sputum culture, it is a gold standard method, but this method takes weeks to give results. So no for sputum culture as well. Third, line probe assay. Line probe assay, this is used for drug resistant testing and only after TB has been confirmed. And last, CBNAT. And CBNAT is the correct answer. This is the next best step for TB confirmation. Okay, so our third question. A 45-year-old farmer presents with complaints of high-grade fever with chills, retroorbital pain, and conjunctival suffusion. And on examination, there is a severe calf tenderness. And lab investigations reveal hypokalemia and neutropenia. And these are the options. So let's quickly focus on the key clues. Number one, occupation. The patient is a farmer. So whenever an occupation is mentioned, we should think about diseases related to that occupation. So farmers are often exposed to animals, contaminated food, water, and these increases their risk for certain infections. And the major clue here is conjunctival suffusion and calf tenderness. These two symptoms are the classic signs of leptospirosis. Conjunctival suffusion refers to redness in the eyes without pus, and this is a hallmark of leptospirosis. And second, severe calf tenderness, and this also commonly seen in leptospirosis. All right, let's quickly analyze the answer choices. Number one, dengue. So, the presence of retroorbital pain might make some students think of dengue, but dengue does not cause conjunctival suffusion. Okay, so remember this. And also, dengue has some other hallmark features like nausea, fever, rashes, and thrombocytopenia, which are absent in this case. So, dengue is not the answer here. Second, chikungunya. Chikungunya present with fever and joint pain, but the joint pain is typically crippling and severe, which is not mentioned in this case. And chikungunya does not cause conjunctival suffusion, which is the key finding here. So chikungunya is not the correct answer. Third, leptospirosis. Leptospirosis is caused by a bacteria Leptospira, and it is transmitted to humans through contaminated water and animal urine, especially from rodents. And farmers are the higher risk of exposure to leptospira due to their work environment. And conjunctival suffusion and calf tenderness are the hallmark symptoms of leptospirosis. And hypokalemia and neutropenia are also common finding in severe cases of leptospirosis. So since all these findings match our case, so leptospirosis is the most probable diagnosis. Malaria, again, malaria can cause fever and chills, but it does not cause conjunctival suffusion. So malaria is not the answer. All right, this is our last question. Which of the following is incorrect regarding the disease association of Parvovirus B19 with the respective patients? And these are the options. So, in this question, they are asking which complication is not related to Parvovirus B19. So, let me tell you, this Parvovirus is a very, very important topic for your exam. So, don't overlook it. All right. Now, quickly analyze the options carefully. The first option says child erythema infectiosum, and this complication is caused by Parvovirus B19. Erythema infectiosum, it is characterized by slap cheek rash on the face and a lacy rash on the body, and it is also known as fifth disease or slap cheek syndrome. So, this complication is caused by Parvovirus. Okay. The second option say hemolytic anemia aplastic crisis. Again, this complication is caused by Parvovirus B19. Parvovirus stop red blood cell production for a short time, but in patient with pre-existing conditions like sickle cell diseases or thalassemia, they can cause severe anemia known as aplastic crisis. So again, this option is related to Parvovirus. Now let's look at the third option, pregnant non-immune fetal hydrops. It is also caused by parvovirus B19. If a pregnant woman gets infected with parvovirus and she is not immune, the virus can infect the baby. and cause severe anemia, heart failure, accumulation of fluid in the fetus, and leading to fetal hydrops. And this is a very well known complication of parvovirus B19 in pregnancy. So again, this is related to parvovirus. Finally, the last option, young females polymyalgia rheumatica, and this is not caused by parvovirus. This disease, it is an autoimmune and age-related disease, and it is not caused by parvovirus. So option D is the answer. Alright, that's all for this video. If you found it helpful, don't forget to hit the like button, subscribe to my channel, and share the video with your friends. Thanks for watching. See you in the next one.